We did a survey as part of my PhD, which had like 2,000 responses. So it was a pretty good sample size. And what we found was the most common reason why runners incorporate any type of strength and conditioning into their week is to try and reduce the risk of them getting injured, which is kind of surprising in some ways, because what we've already gone through so far is all around strength training improves economy and it improves performance. So surely that should be the main reason. And a kind of, equally convincing body of literature doesn't really exist for strength training reducing risk of overuse injury in runners, surprisingly. So, I guess the way that S&C coaches and physios would come at this is largely theoretical. Like, we know through quite a big body of work that heavy mechanical loading, so heavy resistance training or plyometrics, is a really, really good stimulus for improving bone mineral density, tendon density, and some studies looking at tendon cross-sectional area, definitely resilience of ligaments and changes in fascicle length, so we can cope with heavy eccentric loading cycles a little bit better. And so therefore, if we improve the kind of resilience and capacity of these tissues, we should be able to cope with greater volumes or intensities of running training before that tissue kind of reaches its threshold of failure, if you like, and we start to get pain or some sort of injury. If we then overlay the kind of correlation evidence, so what I mean by this is there's been quite a few studies over the years that have shown that low hip strength, so particularly if you've got weak glutes, that seems to be related to injuries like gluteal tendinopathy, IT band, so iliotibial band syndrome, knee pain, patellofemoral pain, and even one or two studies looking at Achilles tendonitis. So that would kind of suggest that if I strengthen my glutes, I'm less likely to get those types of injuries. But actually, when you look at the intervention study, so a study that's tried to strengthen the glutes and then looked at incidence of injury over a long period of time, there aren't really very many studies that have shown that that's the case. They are quite poor studies. So in other words, the groups of participants they use don't get supervised. Most of the exercise interventions, certainly me and you wouldn't regard as strength training. They're kind of these home-based types of interventions. They're often quite short, so they may be only a few months long. And so we probably need a longer period of time to actually get the adaptation and then see it have a positive impact on injury rates. There's been one study which was done in the military. So soldiers that were undergoing basic training, and they were doing a lot of running work as part of that. And they showed that if we use a high frequency approach to strength training, so they were doing strength training every single day as part of their warm-up for about 15, 20 minutes. So they saw lower injury rates compared to a group of soldiers that weren't doing that and were just doing their normal running training. So it might be that a higher frequency approach and a kind of micro dose type approach is the better strategy to try and offset the risk of injuries.